Dr. Shefali Agrawal, surgical oncologist practicing in New Delhi, and I've been asked to give you a few pearls, a few bits of advice on how to tackle the breast cancer problem in India. Just as a comparative standpoint between the US, where I trained in surgical oncology before returning to India 3 years ago, one very big difference between India and the West is that most of the cancers discovered in India are discovered by women on examination or by their gynecologist, which means it's what we call a palpable breast cancer. It has already become a lump which other people can feel. Whereas in the breast, most of the cancers are detected on mammography, on mammograms, which means that as yet, nobody, including the doctor or the patient, can feel the cancers. They're very tiny and can only be detected on a mammogram, which is nothing but an X-ray, a sophisticated X-ray of the breast. So the advantage of doing this is that you detect cancers when they are very early. They're usually stage 1, and the survival for stage 1 breast cancer is 90% at 10 years. So there is mammography has been shown to be the only test or radiological imaging test which helps detect breast cancer, detects it at a much earlier stage, reduces mortality from breast cancer by over 25%, and helps minimize the extent of treatment required. If you detect breast cancer late, the chances are that you might require a mastectomy, whereas if it is detected in the early stages like stage 1, you're likely to get away with just removal of the breast cancer and the sampling of the lymph nodes. So the extent or requiring major surgery is also very much lower with women whose cancers were detected on a mammogram. The other advantage is that you don't need major breast reconstructive surgery, which adds to the complications of the surgery, the duration of the surgery. So not only for reasons of just mortality and improving survival from breast cancer and early detection, even the extent of treatment is reduced if you have an early detection of breast cancer. So screening mammography is the strongest recommendation when it comes to the prevention and early detection of breast cancer. And I would encourage you to visit the website breast-cancer-india.com. It will give you more information on not only mammography, but the recent advances in breast cancer treatment as pertinent to you, your family and community members. Thank you.